And it takes us to that stippled mountain that's much lower, a hill actually, down to 100 to 200,000 deaths, which is still way too much.
Big story of the week, it's how fast this is spreading and how far it's spreading. This is not a one hotspot New York City story. There's going to be hotspots all over the country. Some cities will be worse than others. It'll be cities, it'll be small towns. This is a national problem. It is not one bad spot in New York. It takes time to understand something, and a virus is a complex organism that's moving really fast. The best scientific communicators, they can't tell you what they don't know. And there's a lot of things they didn't know about this. At the beginning, they told us you catch it by being within a few feet of someone who was sneezing or coughing. It's what they call the droplets. That's still a way to get it. They weren't wrong. But as it turns out, the understanding of how it's transmitted is more complex and multi-layered than we heard a few months ago.
From recent studies, we know that the transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood. So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering.
We've got this big debate. Do we need masks? Do we not need masks? The doctors and scientists don't agree, and they're not talking about it the same way they were a few months ago. So people are very upset about that. So healthcare workers need masks. And there's a debate now about just the rest of the public. Who needs them the most? Do we know how to use them right? I think there's also some fear that if you say wear a mask, people will think that's all you need, and that's not the case.
When the advisory comes out, it will be an additive piece if it comes out, rather than saying this is a substitute for.
We know from the mortality, from the deaths, particularly in China and in Italy, we do know that this does hit older people and people who have other conditions. So the message was, young people don't have to worry about it that much. You're not at risk. There are not as many younger people, whether it's 20s, 30s, 40s, 50s. But it's not like it never happens or it's impossible. It sometimes can happen, and we've seen that in New York. We have seen some younger people die. There's been a lot of inconsistency between the states and the federal government. A number of the hard-hit states were ahead of Trump and the federal government in imposing stricter guidelines or requirements. And when Trump was talking about lifting these guidelines, mandates, whatever you want to call them, a lot of states, including, again, some Republicans, said not so fast, we're not lifting them. Now, President Trump has put us under these guidelines, but not a national stay-at-home rule. It's guidelines. Federally, they're guidelines. They're not federal mandates.
Well, we've talked about it. I said, let's think about it, and we did, and we studied it, and by the time the evening came, it just was something that was very unwieldy, very tough to enforce, and something we didn't want to do.
President Trump has sort of focused on too narrow a solution, and he really didn't talk about it as a lethal pandemic until very, very recently.
I think it's going to be under control, and I think I can speak for our country. For our country is under control. I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks.
President Trump thought it was something he could stop some air traffic and stop a virus. And it didn't stop. People were already here, as we now know. We weren't testing properly. We weren't looking for it. Changing travel patterns and travelers from one country wasn't enough. And there's so many changing messages. You've got the changing, evolving science, and then you've got whatever the politicians are saying. That doesn't mean they're lies. It means, with the science, it's what they thought they knew in January isn't what the science is telling them in March. The scientists are trying to get their arms around it and understand it quickly. But for the public, when we want certainty and we're frightened and we're worried, it becomes confusing and anxiety-producing when we hear different things. It adds to, people want to know how to protect themselves and their families, and it's very difficult.